I have a question that I received recently from a patient about a right hemiarthroplasty that he had on his knee, which is a partial knee replacement where they replace half of the joint. In his situation, it was the medial aspect, or the aspect that's on the inside of the knee. So he said that years ago he had a left hemiarthroplasty on the left knee, and it went really well. But when he had the right one done recently, he's been having severe sharp pain at the end range of flexion. In the left knee, he has about 115, 120 degrees of flexion with no problem. But on the right, he's getting deep, sharp pain between 95 to 100 degrees. And he said that he's gone to a physical therapist, and he's gone through a whole course of physical rehab, and this issue hasn't changed. So he's asking my advice on this. He's asking essentially if he should go back to the orthopedic surgeon and if he should have another imaging study done. So I recommend, yes, you should have imaging done again. You should have a repeat radiograph of your right knee, but I would recommend that you ask your orthopedic surgeon to do what's called a lateral flexion view. Instead of doing an anterior or posterior view where the radiograph is taken straight on or in front of the knee or from behind the knee in a straight extended position. Instead, because you're having pain in flexion, I would recommend that they put you in flexion and take the radiograph to see what structures may be getting pinched or compressed at the end range of flexion. Now, normally a lateral flexion view is done in 20 to 30 degrees of knee flexion. So this is what it would look like, where this would be representative of full knee extension, where your knee is completely straight, and then they drop you down to 20 to 30 degrees of knee flexion, and they take a lateral view or a sideways view. However, in your situation, because you're getting pain way further than that into end range, I would ask if you can have the lateral flexion view done in far deeper knee flexion, so somewhere around 110 to 120 degrees, or wherever you end up feeling those symptoms the day you're getting the imaging study. Because if you have your lateral flexion view here, it's not going to manifest where you're getting that catch or pinch. So it's going to give you a false negative. It's going to come out looking fine because it's not capturing the range where you're actually getting the impingement. So the radiograph modification that I would recommend you ask your orthopedic surgeon is dropping down 110 to 120 degrees from the full knee extension range of motion, and then getting an image right there to see what's catching in your joint, if there is something catching or pinching.